Hello, I'm glad to be here. Tonight I'm presenting on our organization's contribution to the context within which we can promote and maximize prescription drug monitoring program in Washington, D.C. Our organization is called the Gadgets, Devices, Technologies, Special Interest Group, and we are glad to be part of a bigger network that is promoting stewardship, judicious use, discipline, adherence, and the idea that communities can push for better practices which catalyze quality life outcomes. Now, I am going to be presenting on our organization's contribution, but at the same time, I'm also going to be outlining the different sections of my presentation. So the agenda is, there will be the goal, specific aims, outcomes, the definition of prescription drug monitoring program. We shall also see how the roles of policies, some of the policies in Washington, D.C. are adding to the promotion and execution of these policies, as well as the different policies and how they are faring out in the different contexts, or in how they appear as instruments. And then further, I shall show our own organization and its own goal, its specific aim, and which outcomes. Further on, I shall talk about the pros of a special interest organization in promoting, in enhancing the outcomes of a policy like PDMP, and then the cons, challenges, solutions, and lastly, conclusion. All right, without much ado, our goal is to advance practices that maximize prescription drug monitoring program goals in Washington, D.C. The specific aims of the prescription drug monitoring program are to ensure that people access services. The program itself improves DC's ability to identify and reduce diversion of prescription drugs. It promotes efficient and cost-effective approach, maximizing appropriate medical utilization of controlled substances. It sets up contexts to improve patient care, enhance prescription, monitoring, information, chart use among healthcare, palliative care, research, medical, and pharmacological contexts. So that is basically the context within which Washington, D.C. translated and transformed the federal prescription drug monitoring program. Now, what is the specific aim of this presentation as well? Well, we shall characterize prescription drugs used in Washington, D.C., highlight policies in place, catalyze movement building to advocate for modernization or modernizing policies. For us, our gist is to avoid intoxication. Our outcomes will showcase special interest groups and how they can contribute to a milieu where it is possible to reduce, rather to maximize the goals of prescription drug monitoring program, but at the same time also to minimize the effects of practices and behaviors that lead to intoxication. Now, what are some of the opioids that are used or distributed within Washington, D.C., other than those that are prescribed formally and officially? These are benzodiazepines, stimulants, and controlled substances, as well as opioids. Some are prescribed formally and others are shared through networks of acquaintances and friends. Formally and officially, these medications actually relieve pain, but they have been abused. So the role of policies is to advance PDMP. PDMP in full is prescription drug monitoring program goals. So the role of policies in DC is to advance PDMP goals. One of them is to catalyze existence of contexts within which intoxication is addressed. Now, in Washington, D.C., there are more deaths that are recorded, even as far as back in 2019 up to today. In 2019, for instance, there were 576 deaths within 3 of the main wards in DC. But altogether, there have been 2,504 deaths, according to the DC office of the chief medical examiner. So we see that even with policies in place, there are deaths that still continue. Now, there needs to be a solution to that. And one of the solutions that we came up with is to understand or chart out the kinds of policies that are in place, which are in schools in the form they are as instruments or as laws that control the use of prescription drugs within schools, medication centers, workplace, public places, to name but a few, as well as how professionals are encouraged to share information around prescription drug stewardship as well as practices. Now, we came up with an organization called Gadgets, Devices and Technologies Good Use Network. So this is a network within which we are able to continue advocating and advancing for stewardship and good use of prescription drugs. Now, the pros is that in using interest groups, we highlight trends in counterfeits and behaviors inhibiting achievement in PDMP goals. Now, the cons are, it is the lack of financial resources to facilitate continued advocacy and efforts to advance PMD goals that affects that. Now, what are some of the other challenges? The major challenge is inability to establish causality and basis to suggest changes in policy. Now, what are the solutions that we have come up with, or we intend to continue advocating for and advancing? One of the solutions is build partnerships with other advocacy groups and commit to share as well as mainstream PDMP objectives in organization, group, action plans. Now, in conclusion, talking about PDMP or prescription drug monitoring programs with communities enables them to plan and enhance PDMP goals, to increase participation by DC residents in practices maximizing PDMP goals. Community action plans increase awareness of types and effects of PD. PD is prescription drugs. Community action plans increase critical mass of people involved in prescription drug monitoring plans or programs, activities, and then innovating and identifying the DC prescription drug monitoring program, Act paragraph 9. This is what we wanted to be able to change so that it can be able to read. Instead of just saying substances, we want it to be categorical and read deceptive gadgets, devices and technologies that are used to introduce drugs in the body, which increase intoxication. So we are going to advance and advocate for that so that it is added within the Act, the program, the DC program actually, which translates the larger prescription drug monitoring program federal policy. At DC, there's a law where we want to change to improve on the paragraphs, especially paragraph 9, so that it also reads that they are gadgets, and it's so that gadgets, devices and technology, so that we are able to also follow up on those gadgets and see how we can then control prescription drug use judiciously and as stewards to maximize PDMP goals, but also minimize life-harming practices. I hope with that you'll be able to follow us as we go on advancing and promoting better life and maximizing PDMP goals. Thank you. Bye.